Hi class, my name is Jessica May. I'm actually recording this video from my parents' camper, which is ironic. My grandmother passed away a couple days ago, so my parents' house is packed full with 20 plus people with my sisters and family. So this was the only quiet spot I could find. My video might be a little more short and sweet than I had planned due to the circumstances. The nursing informatics information problem that I could think of clinically has to do with I work in an inpatient and outpatient oncology. I do both floors. But the issue that I see is if a patient is in the outpatient having a chemotherapy or a blood transfusion and reacts to that, we give them the medication to counter the reaction, but most often the nurse practitioner or MD wants us to re-challenge that patient. So the clinic is only open till 5:30. So if the blood transfusion or chemo is going to go past that, often the patient needs to be transferred up to the inpatient floor to finish the blood or chemo. However, we have Epic, and as you know, every encounter is separate in Epic. So when the patient transfers up to the inpatient floor, they cannot see that patient. The inpatient nurses aren't trained in Beacon, the outpatient charting, and vice versa. So the problem is that these nurses don't know how to find this patient in Epic. Our nurse educator did pull up some sheets to walk people through it, but it's very cumbersome. Everyone's very frustrated about it. I'm the only nurse who does both floors, so if I'm there, it runs a little more smoothly, but obviously I'm not there all the time. So the bigger problem I see is when I'm on the inpatient floor and this patient comes to us to finish the chemo or blood and God forbid reacts again or it becomes an emergency situation, then the inpatient world does not see this patient. So as far as putting orders in, coding this patient, transferring him to ICU, this patient actually does not exist in the system. So it's actually kind of a situation that the nurses shouldn't be put in and anybody shouldn't be in. Every time this happens and the patient is on the inpatient floor, it gets addressed for that day, and people are like, well, why is this happening? Why can't we fix this? And then it goes away, and then we don't worry about it until it happens again. And I don't know what the solution is to this. I don't know why the patient couldn't, be put in as an observation. I know it affects billing, all sorts of those things. But that is my information informatics problem, and I hope you are all doing well, and talk to you soon.